pattern and all. Gotta put my glasses on. Well, thank you all again for being here with us this afternoon. I have with me Dr. Jennifer Vegno, who you know is our Director of the Health Department here in the City of New Orleans. Of course, with us also is Winston Reed, who is the Director of Code Enforcement and the convener of our enforcement task force that crosses multiple departments throughout the City of New Orleans on that ground. I also have Superintendent Tim McConnell with the New Orleans Fire Department that will be touching on some information I wanted to share, along with our City Attorney, Miss Sunny LaBeouf. You'll hear from them as well. But right now, I'm coming to you today. I'm announcing an additional restriction to be put in place given the rise in case numbers and large gatherings over the past 2 weeks, but more importantly, with a real focus on getting our kids back into the classroom. And you know, with the New Orleans Public Schools, I stood with the leadership there on Tuesday outlining their plans for the start of school being distant learning. At that press conference, I also mentioned that the focus that this city needs to have, and quite frankly, is on our children. And when we are focused on our young people, our children, we bring everything else right along with us and where we need to be. So with that, since we've moved to phase 2, the city has seen an unfavorable trend with the COVID-19 virus. This is something that we have been communicating to you all and to the public since we started into phase 2. We've also since then kind of rolled back a little bit. We called it phase 1.5 because we had to do some further restrictions as we noticed again the uptick in positive cases in our city. But you know what? Almost doubling the daily average cases to approximately twice the threshold size of 50 cases per day. Increase in positivity rate from 2 to 3% to over 6% in Orleans Parish. A more than doubling of the COVID positive hospitalization rates with overall saturation of the local health care system. We know that we are receiving, and we are happy to do that, but we have an increased overflow burden as it relates to us receiving residents from around the state of Louisiana and even the state of Mississippi. It's a clear indication that we have returned to widespread community transmission. We want to stay on the right track. We took a dip, but I have really the faith and the confidence in the residents of the city of New Orleans as it relates to where we are, where we need to be, focusing on children, getting them back into the classroom. And therefore today, I am going to be starting as of tomorrow, 6 a.m. All bars and restaurants in the city of New Orleans will be prohibited from selling take-out alcohol beverages. So what this essentially will mean is that bars will be closed throughout Orleans Parish. We understand the impact that this is having on our bar community. We do understand. That's one of the reasons in terms of us moving into phase 2. We were very much focused also on our economy and those industries that make up the economy. And we know that our bar community has been a part of that. Unfortunately, we have seen the negative impacts that has had on the city of New Orleans, and quite frankly, we're seeing the impacts that it has had on other parts of our country. Both those that did go forward with opening bars, even minimally. We did minimal. However, the impact was there, but we saw it, and it's a real thing. So I'm having to do this again, 6 a.m. Tomorrow. The sale of takeout alcohol of bars will come to an end until we move into a better position of public health in the city of New Orleans. And quite frankly, as I mentioned from the start of this, our goal is to get our children back into that classroom as soon as possible. Every day, not in a seat, it does matter. Even as we are focusing on providing supportive services to our school community, to parents and families, while they will start the school utilizing distant learning. I'm also announcing more restrictions as it relates to limiting the gathering size to 10 as it was in phase 1. Again, we have seen the uptick in positive cases that are directly aligned with bars, directly aligned with large gatherings. I'm hoping that this will prevent the large gatherings and activities even that we have been seeing along Bourbon Street, for example. It has gotten out of control. We're announcing also, I like to, you have a little stick, but I try to create a carrot where I can and look for a silver lining or a win-win every step and every chance that I get. So over the course of last night, working thoroughly with my CAO, Gilbert Montano, we are announcing a new incentive grant program for restaurants to support and expand their operations. Now, while I'm not rolling back a capacity for restaurants, I am encouraging our restaurant community to really think about expanding their outdoor capacity. You know that in the beginning, as we moved into opening restaurants, I relaxed the process relative to utilizing public rights of way, and even as it relates to businesses utilizing private property that may be adjacent to their restaurant. Well, this is wanting to kind of take it just a step further with providing individual grants up to $6,000, making them available to our local restaurants and other businesses that wish to add or expand their outside dining. This funding will allow for any physical improvements needed for outside dining. So whether that can be, tables, chairs, tents, a misting system to keep people cool, any types of innovative and creative ideas that we know that our restaurant community that they've been thinking about, and some have also been doing it, but this is a way for us to meet them where they are with some funding to make that happen for their business, expanding again curbside, as well as moving our plans for streeteries throughout the city of New Orleans. The program will begin with the piloting curbside dining and parklets in 5 to 7 commercial corridors over the coming month. And then the program will expand citywide from there. The city has already, as I mentioned earlier, waived permitting and inspection fees to expand outdoor seating. This will again be ongoing. For the purpose of this program, I will say that it will be approximately at the start of it $250,000 in funding that we are making available right now. While we're in a pinch, in a real fiscal and financial crunch, we have to be smart about it. And being smart about it means that coming up with creative ideas to help our restaurants out, businesses keeping the economy going the best way that we know how, given the constraints being demonstrated by COVID-19. We are launching the city's virtual Build NOLA small business training program in partnership with Delgado and other local and regional partners. We've been working on this. It is coming alive and we're excited. Registration opens today and will continue through August 24th, course 2020. Entrepreneurs and small business owners can register at www.buildnola2020.com. This is live today, so it's exciting. The city has and will continue to support our local small businesses who are the backbone, quite frankly, of the city of New Orleans. We know that, we feel that, we see that, and we see you, meaning small business owners in our community. It is important that we extend support and assistance as it relates to aiding them in fueling not only their recovery, but our recovery as we move through this pandemic. As I continue to say, what happens next truly depends on what we do right now. And what I want to happen next is for our children to be seated in a classroom throughout the city of New Orleans. And I mentioned in that announcement on Tuesday that the most cascading effect is this coming from distant learning and not being able to open the doors of our school buildings to our children. And cascading effect because it touches all of us, our business community, of course, city government, all of our city, our economy truly does depend on it as well. So with that, I'm going to turn it over to Dr. Jennifer Avegno to give you more insight and knowledge from a healthcare perspective as it relates to where we are and where we're going in the city of New Orleans. So thank you again, and I'll be right back. Doc.
Thanks, Mayor. Hi, everybody. I'm going to open, as I usually do, with a snapshot of where we are, cases, testing, and hospitalizations. Since mid-June and our phase 2 reopening, we've watched our average daily cases steadily increased. It's been a pretty alarming trend that's continued even as we've tightened some restrictions. Our average new daily cases have been well over our set threshold of 50 cases per day for nearly 3 weeks. Every model that we look at shows that our transmission rate, or how quickly the virus spreads in a community, is above the number 1, which indicates widespread community transmission. That's clear as well in our positive case rate, the percentage of tests that come back positive, which has more or less doubled since June, as the mayor said. In terms of testing, as you all know, we've had some challenges in obtaining key testing supplies, which has caused some of our partners to have to limit the number of tests offered daily. Others are experiencing long turnaround times with some of the labs that they're using. But I am pleased to announce today that after repeatedly elevating the issue nationally, the federal government has agreed to send us surge testing resources here in New Orleans. So these resources are similar to what you may have heard going on in Baton Rouge, and they're going to allow us to significantly increase the number of tests offered to residents in the region on a daily basis. This is a program that's come together very quickly, just in the last 2 or 3 days. It's going to be supported by the Louisiana National Guard, Louisiana Department of Health, and of course our city health department and Homeland Security. It's going to begin next Tuesday. Our first site's going to be back at the UNO Lakefront Arena, where we had our earliest testing sites. This site will be a drive-through, like the original one was, between the hours of 8 a.m. and 6 p.m. Plan is to rotate locations on a weekly basis at the sites of many of our universities in town who have been fantastic partners in bringing this together. And it'll likely on those other sites be some combination of drive-through and walk-up to make it as accessible as possible. Again, as I said, this is coming together very, very quickly. We will have information for you on ready.nola.gov/testing very soon. In terms of hospitalizations, as the mayor said, they are on the rise statewide, including Region 1. While our local hospitals continue to hold strong, any significant increase in cases could overwhelm the system. You have seen hospitals around the state, including Our Lady of the Lake in Baton Rouge, which is a very large hospital, cancel their elective procedures. And for those of you not in healthcare, this is a drastic step that indicates how overloaded many of our state hospitals are. Staffing is incredibly tight throughout the state, which can be dangerous for personnel and patients alike. So if you do not want to put healthcare workers and already sick patients in hospitals in further danger, please follow the guidelines that we've set. As a reminder, all of the data that we look at is available publicly on our dashboard, which you can find at ready.nola.gov/milestones. So as you've heard us say repeatedly, and the mayor just said, our primary goal at this point in the pandemic, is to suppress the virus necessary to a level that we can safely send our children back to school. Unfortunately, we are not there yet. This is evident in the recommendations that the White House issued this week for states, in which they recommend significant further restrictions in the state of Louisiana. Looking at our trends in new cases, which continue to be in many respects linked to social gatherings and bars, we don't believe that we can get to the level we need under the guidelines that we've been under for the last few weeks. Our enforcement team that you'll hear from has responded to numerous complaints, large gatherings of individuals socializing with drinks outside of bars, house parties, on the street, not wearing masks, not distancing, not adhering to gathering sizes. This is dangerous behavior, again, that can lead to rapid transmission. So for this reason, as the mayor said, we will be prohibiting all takeout and drive-through alcohol sales. Bars, regardless of whether or not they have a food permit, and restaurants will no longer be allowed to make takeout or drive of alcoholic beverages. At the time, we're choosing to stick with the gathering restrictions. Again, that's 25 for indoor, 50 for outdoor, but all gathering participants must wear masks and must socially distance. These limits are for a reason. They are not suggestions. They are for everybody asking for a variance for their particular situation. We will be consistent. No one's event is more important than the health and safety of our community and the need for schools to reopen. Again, it's important to note that the closure of bars and keeping gathering sizes small, even further if we need to, are both recommendations made by the White House task force due to what they are seeing as the surge of cases statewide. So we agree that restricting those activities that continue to be clearly linked to new cases just makes common sense. I want to make a point about socializing even on a small scale. Just because you can go out to brunch or dinner or somebody's house doesn't mean you always should if they're not someone in your household. We are seeing a lot of spread from individuals thinking it's okay to gather frequently and let their guard down when one or more of them are infected and pre-symptomatic. And if you are exposed to a close contact who turns out to be COVID positive, you cannot simply get a quick test and move on with your life. According to CDC guidelines, which we adhere to, you must quarantine for a full 14 days in that instance. So I just want everybody to keep that in mind when they're planning their activities. Would it be something that you can do safely and follow the guidelines, or is it something that might keep you home for 2 weeks? We all agree that the best place for kids is to be in the classroom. So let's let this be a motivator for all of us. Every single thing we do in the next few weeks and beyond should be with the goal of supporting the children of New Orleans. Do everything you can. Stay at home as much as possible. Wear a mask at all times in public. Limit your interactions with others. Maintain distance when you're around other people. Wash your hands often. Regularly disinfect surfaces. If you feel sick, stay home. If you've been around someone who is sick, stay home. These are the same things you've heard me say over and over again since March, but we have to keep doing them. We owe it to our children. Thank you.
Thank you, Dr. Avegno. Yeah. Thank you, Dr. Avegno. And I'm going to ask, Winston Reed, who is going to come up to talk a little bit more about enforcement. But based on these guidelines, again, we are hoping that this will deter large gatherings, of course, along Bourbon Street, but just gatherings throughout the city of New Orleans, even as relates to street performers, allowing crowds and that sort of thing. But we know the trigger is that sale of alcohol, and that has just been something that has taken us in the wrong direction. Also, there has been an uptick in the usage of party buses throughout the city of New Orleans that not one is properly permitted to operate in our city. So they're illegal. And Winston will give you a little bit more about that. Also, short-term rentals. We've seen an uptick, large gatherings, large parties at short-term rental. Make no mistake about it, you will lose your permit indefinitely. We're not playing around. So I'm going to bring up Winston Reed, who will give you more from being boots on the ground relative to the need for enforcement and consistency. Winston, come on.
Thank you, Madam Mayor and team, for your leadership. And to our state and city partners, I thank you thus far for the work that we've done. I want to be clear. We not only plan, but we take these restrictions seriously. We plan to enforce them to the limits they're allowed to us. We want to be clear. We must do this for the sake of public health and for community spread. And I will be remiss if I didn't thank you, the public, our citizens, our business community members, everyone who have played and will play a hand in this effort. You are the biggest part of this team effort. We implore you, we need you to keep calling 311. If you see social gathering, party buses, anything that you think that may be legal, anything that you think that may lead to an oversized congregating, we want to hear it. We plan to be visible. We plan to be fair, but we plan to enforce these restrictions and limitations to the fullest. Again, it's imperative that you follow these rules and restrictions, because at this point of the game, we have no choice but to step up our enforcement action. And so again, to you as a team member, as that missing link, the team, the public, we thank you so much thus far for what you've done with us. But we have a ways to go, but we're getting there. Thank you so much.
Thank you, Winston. Thank you. So what I will do at this time, I'm going to stop and just take some questions relative to this topic. I did not want what I wanted to do was maximize your time. And so I'm folding in another issue that I wanted to provide you and give you an update from the city's perspective, but that will come next. So if we can have Q&A, Ms. Latanya, relative to this part of the press conference.
Absolutely, Madam Mayor. WWL.
Mayor, you said limits of gatherings are 10 people, but Dr. Avegno said 25, so we just want to make sure we're hearing the right understanding right.
No. Limiting size gatherings. I was talking about, well, in phase one we have the 10 where we started, but we are still at our 25 in regards to those gatherings. But we want, you gotta, it's that crew of 10 kind of we talked about. Have your crew, that you're with, that you do some of the same things with. That's your safe haven, so to speak. But we're seeing they're larger than 10, but then it's just people that end up and the crowds just grow and grow and grow. And even as of, when we were allowing for takeout alcohol, one example, some of the lines would be so long that they would become a gathering in and of themselves, and then no mask wearing and the like. So the best thing for us to do was to, prevent these types of sales moving forward. So I apologize for
The advocate.
I'm curious, obviously there's been an increase in cases since phase 2, but it seems that over the last week or two, it's been relatively stable at around 100 or 80 to 110.
average.
I'm curious, A, whether there's something specific that you guys are seeing that is prompting additional restrictions, B, whether the results of contact tracing are pointing specifically to the bars and the other establishments that are affected by this, and I guess to confirm, would loosening restrictions be dependent on getting back below 50 then, or?
Loosening restrictions at this point is going to be centered around whether our children are back in the classroom or not. That is the top priority. As it relates to the uptick in positive cases, yes, they are directly linked to bars. They are directly linked to large gatherings and parties and the like. And this is something that we have been saying. And I think you had something else. I'll ask Dr. Vegno to come. I thought there was something else you had.
So to answer your first question, yes, over the past week, the numbers have been relatively consistent, but they are twice our threshold. So, that they're already not where we want them to be. Just because they're the same doesn't mean that that's good. We've had a few days with 120 and 130. That's very concerning, and it's not just due to increased testing. We do have a lot of testing, but the positivity rates have been higher than when we had less testing. There is a real link between our cases going above the threshold and what's happening in our hospitals. Of every 100 cases, a certain percentage of them ended up in hospitals, and a certain percentage of those die. And so even though New Orleans is doing better compared to almost any other parish around us, all of them are increasing hospitalizations based on their cases, and that is affecting us. So, we set that threshold for a reason. There was a lot of science behind it. And again, if we've got the White House and national public health experts with every metric telling us that we are above the threshold we need to be to do things safely, we have to take action.
That's for Dr. Vegno?
This is probably for either of you.
Okay.
Although Vegno might know the numbers better. I don't have the numbers in front of me, but the hospital, both bed and ICU capacity, is pretty healthy in Region 1 right now.
Well, it is, and it's not. Our hospitals did an amazing job setting up extra units, right, when we were in the thick of COVID back in March and April. They haven't been using those. Those didn't exist pre-COVID. They're ready to activate those, and in fact, some of them may have activated them already, right? So we're surging in the hospitals. What we're seeing, though, in the hospitals is that they are receiving requests for transfers from all over the state and from neighboring states, because so many of our other hospitals in the state are completely full. So what we're seeing locally is that our local hospitals are having to start restricting those transfers because they are at capacity. So we're at a very dangerous position right now. If the other hospitals aren't getting under control, and again, the fact that Our Lady of the Lake and others canceled elective surgeries should be a huge sign that they are incredibly concerned. They don't have room to do what normal hospitals do. And as much as Region 1, we do have good capacity, and we can take some of that, but there is a limit to what we can take. And again, the COVID positive hospitalizations are not in the same numbers they were in March and April, but no one else was in the hospital then. The COVID positive hospitalizations have doubled or more in the past few weeks. And I'll tell you, being on the ground in the hospitals, I see my colleagues getting exposed to many more COVID patients than they had been previously.
So in Region 1, are we seeing similar things to what they're seeing in 4 and 5, where it's not purely the COVID positive patients, but it's a combination of the COVID positive
right.
patients?
It is a
and
combination.
The larger.
A bed being taken is a bed being taken. Doesn't matter who's taking it.
WD issue. Yeah.
In reference to you said that on Bourbon Street things have gotten out of control. Kind of describe that situation that you were seeing that led to this decision, and just to make sure I'm understanding the bars.
It was many of them. Go ahead. I'm sorry.
Just to make sure bars could stay open for takeout food, or do they have to just completely, even if they can sell food?
Bars closed.
Got it.
There are 20 bars in our city that have the special permitting from the state. There are a total of 30 statewide. 20 are in Orleans Parish. Okay? But all the others are officially and permitted as bars that will not be allowed to serve takeout, which means that our bar community will suffer from this decision, unfortunately, but it's one that just has to be made to get our kids back into that classroom. Now, what I've been seeing is not just around the French Quarter or Bourbon Street, which it still matters there, and that visual hurts us around the city because it incentivizes other people around the city to just go do the same thing, and they do, and they have, and we've had to respond to that, and even in real time, and we have, where there could be an upward of 200 folks gathering, then 2 party buses pulling up, a second line, a brass band there. Police responds to a gathering, shows up, and then needs more backup because it's far larger than what they even anticipated. But this is a problem. Also, an example could be we did permit a drive-through, and you can get me straight on the right terminology, Winston, but it was at UNO, and to follow the proper guidelines, and we permitted them. Well, they didn't follow them. They were out of their vehicles, they were dancing, they were not following the guidelines. And so we are going to take and make extra effort and take extra caution as it relates to those types of events, but we're not going there. So it's been a multiple examples, just citywide. And initially I thought about time, like a little, whether it's a close early type of thing, but as I reviewed footage and pictures and all of these things, they were happening in broad daylight as well. So this has led to the decision that I've had to make.
Jambalaya followed by Fox 8.
Mayor, any other way to report these gatherings? Because sometimes the 311 is not work.
Well, it works. It's just a lot of people calling, which is a good thing. But over the past week, actually, one example is that we've had to hire up, and we're still hiring, but through Job One, to increase the number of employees and heroes behind that headset, as we like to call them, at the Orleans Parish Communications District where 311 is located. So it is an ongoing effort in onboarding more individuals, simply because we do want to keep up with the number of calls that we are receiving, and it's a healthy number, so that's great. But I want you to also understand that while you can call 311, you can also email, so they can receive any of the specific information from residents or visitors by calling 311 or also emailing 311. Okay.
And finally, Fox 8.
This is regarding hospital capacity.
Okay.
Just to clarify, you said Region 1 hospital capacity is in fact surging? Okay.
It's
So the
receiving.
numbers, the numbers have gone up. See, COVID positive numbers have about doubled or more, I think, in the last couple of weeks. Yep.
And so we're currently taking other patients from other parts of the state.
We are.
with Overflow capacity, but also in neighboring Mississippi.
Yep.
Is it going to come to a point where we can no longer do that and say we can't take the patients?
I hope not, but but that's a reality that everybody's facing. That's a reality that the rest of the hospitals in the state are facing. So it's certainly one that this is why we generally try to be proactive and even have to place these additional restrictions, because we do not want to get to that point.
How far do you think we are from that point?
I can't tell you how far. And again, our healthcare system here in Region 1, Orleans, Jefferson in particular, when we were very close to that point in April, they did everything possible, really heroic to not get us to that point. And they've learned all those lessons and are really a model. So I know they're going to do everything possible not to do that. But again, it's not just beds, it's staffing. We have to think about our healthcare workers. They are tired. They have been doing this for 4 months. They have been putting themselves at risk. And it's not just our nurses and doctors, it's our environmental services, it's radiology, it's respiratory, it's everyone who touches a hospital patient. They are really tired and are starting to, see some staffing issues here and there because, right now nurses